A man in Edmonton diagnosed with stage 4 cancer this spring has been waiting more than 60 days to see an oncologist. Alberta's health minister says she's committed to addressing the challenges as doctors on the front lines call the situation critical. CTV's Chelan Skulski reports.
Devastates me, and it sucks all the hope out of my system.
Cece Nguyen describes the last 2 months as terrifying and frustrating as she watches her once healthy husband fight for his life.
Do they know that he's like a father of 3 young kids? Do they know that he's 41, who doesn't smoke, doesn't drink, has an active lifestyle? And do they know that he wants to fight?
Stephen Wong was diagnosed with stage 4 gastric cancer on May 2nd. Since then, he's spent 48 days in hospital due to complications, including a collapsed lung, gastric bleeding, and a stomach rupture. He's still waiting for his first appointment with an oncologist.
Other doctors have told us he's ready for treatment, and you still get then he's going to be put back into the system, and now you're going to have to wait 4 to 6 weeks on top of the 60 days.
That's definitely not appropriate. It's not what we're targeting at all. We should be seen in less than 4 weeks and sooner if possible.
Alberta Medical Association President Dr. Paul Park says while Stephen Wong's wait doubles the province's benchmark of 4 weeks to receive cancer care, it's not unique. Some patients are waiting up to 16 weeks. His concerns are echoed by oncologists on the front line.
The risks with delaying for cancer is unfortunately death.
According to the AMA, the number of cancer diagnoses have increased by more than 40% over the last 10 years. During that same time, 20 oncologists were hired.
You don't have the commensurate increase in workforce. That's where you get the bottlenecks, and I think that's become a crisis.
Alberta Health Services says it is currently recruiting for positions throughout cancer care, including oncologists, medical physics, nursing, and radiation therapy. Adding, Cancer Care Alberta hired 17 physicians in the last year.
They're not doing enough, because if they were doing enough, people wouldn't be dying waiting.
Criticism Alberta's health minister acknowledges, as Adriana LaGrange says there is more work to do, competing to bring top talent to our province. Chelan Skulski, CTV News, Edmonton.